Hello class, this is Mashid Azamia.
This is Kelly Koklaser.
This is Ahla Muhammad.
And this is Kiana. We
are
Group 10. And we are happy to present to you our case study on precocious puberty in females.
So what is puberty? Puberty is defined as changes in reproductive physiology and physical appearance representing the transition from childhood to adolescence, basically when children start looking like adults. Typically, puberty begins in girls at ages 10 to 11. Early puberty, which is also known as precocious puberty, is the attainment of breast or pubic hair development before the age of 8 years. How is puberty measured? The measurement of pubertal status is actually a complicated process. The gold standard method for measuring puberty remains to be the comprehensive physical examination of the child by a trained clinician, typically a pediatrician, using the Tanner Sexual Maturation Scale. This method represents stages of breast and pubic development, and staging is performed by both visualization and palpation. Tanner Sexual Maturation Scale is shown on this slide. There are 5 stages of breast and pubic hair development. Ratings range from immature to fully developed. Another highly used measurement is the self-report method, which is the most popularly used in the field and in research studies. This includes reports by the adolescents themselves using either photographs, line drawings of pubertal stages, or using the Pubertal Development Scale, PDS. The PDS, as shown on this slide, remains to be the most widely used measure of self-report over the years, and it basically consists of a young girl's assessment of the degree of her own pubertal change on a number of relevant characteristics. Since the external changes in puberty are triggered by hormonal changes, hormonal measurements can also be performed to measure pubertal status in less invasive ways, using blood spot and saliva assays. Other methods and diagnostic tests, such as radiography, are also used to confirm puberty. Bone radiographic imaging of the left hand and wrist is the most common diagnostic test used to determine bone age for confirmation of puberty.
The public health significance of earlier puberty can be anticipated by considering the following. Should there be any concern about the causes of earlier puberty among girls? Are there any worrisome long-term consequences? If the trend analysis evidence reveals that U.S. girls develop puberty earlier than previous decades, healthcare providers will need to reassess their current definition of precocious puberty. Before the mid-1900s, only age at menarche was used to study trends of female puberty among specific U.S. populations. Between the late 1800s and mid-1900s, the average age of menarche progressively declined. This decline was attributed to a better health and nutritional status, including higher caloric intake as well as reduced frequency and severity of illness. Since the mid-1900s, more studies have been conducted, and some have reported a decline not only in the age at menarche, but also in breast and pubic hair development. As you can see in the figure, the age of menarche in several countries has declined by nearly 3 years over the last century. Several studies have been conducted in US. In 2003, a multidisciplinary expert panel evaluated data collected on US female puberty markers between 1940 and 1994. After careful review of the data, the panel decided the order and timing of pubertal events in US girls is different among different ethnicities. Additionally, the majority of the panel experts concluded that there were sufficient data to suggest a secular trend toward an earlier age of onset of breast development on the basis of Tanner's stage B2, but due to lack of comparability of the historical and recent studies, these were not sufficient data to suggest a similar trend toward achievement of B3 to B5. The majority also concluded that the data were insufficient to suggest a secular trend toward age of achievement of PH2 through PH5. Because these states are highly variable, regarding menarche, the panel concluded that the data were sufficient to suggest a secular trend toward an earlier age of menarche, finding that the age of menarche has decreased by approximately 2.5 to 4 months over the period of 25 years.
This diagram summarizes the potential causes of precocious puberty in females. Various explanations exist. There are two types of precocious puberty, central and peripheral. Central precocious puberty may be due to organic lesions of the central nervous system, intracranial disturbances, and severe hypothyroidism. On the other hand, peripheral precocious puberty may be due to ovarian cyst and tumors, exogenous estrogen, adrenal pathology, pituitary gonadotropin secreting tumors, and McCune-Albright syndrome. Some of the environmental factors that have been associated with precocious puberty include high-fat diet, maternal smoking during pregnancy, and most importantly, exposures to many endocrine-disrupting chemicals, such as phytoestrogens, phthalates, PCBs, pesticides, soy products, etc. Genetic factors due to mutations of certain genes like the GnRH1, GPR54, etc. could also lead to early onset of puberty. Other potential factors associated with precocious puberty include intrauterine growth restriction, social stress and deprivation, obesity, and family disruption.
Precocious puberty has numerous complex physical, psychological, and social implications for affected children and families. Young girls exhibiting early pubertal development oftentimes face tremendous social stigma with probable negative consequences for their health and well-being. Being viewed as different from their peers, many of these girls struggle when developing social relationships and a positive self-image. Since body image, self-esteem, and expressions of sexuality are easily influenced at this time in children's lives, girls with early pubertal development are more likely to become aggressive, moody, or socially withdrawn. Numerous cross-sectional case control and cohort studies have also found that early pubescent girls suffer from higher rates of sexual abuse, depression, anxiety, and eating disorders. They are also more likely to engage in other risk-taking behaviors such as smoking, earlier sexual experiences, and having unprotected sex. In addition to psychosocial disturbances associated with precocious puberty, several physical consequences may exist. These include reduced adult height, a greater risk of breast and ovarian cancer, and higher total mortality. Given the complexity and seriousness of such health outcomes, further research examining potential risk factors, treatment strategies, and preventive measures for precocious puberty is imperative.
Hope you enjoyed our presentation.
The end.